Welcome back. It's time for our weekly check-in with Toronto Mayor John Tory. Of course, COVID-19 front and center. A lot of developments to discuss. Good morning to you, Mayor.
Good morning, Mel.
I want to begin with the numbers. So, of course, for COVID-19, a rolling average 7-day new cases, 206, significantly up from what we saw of about 40 in the beginning of September. We're in the modified stage 2, a few days in. How would you say it's going right now?
Well, it's hard to know because the medical officer of health has always told us with all of these measures that there's not an instantaneous response to it. In other words, what you don't get is the day that you close something or have people stay home from school or any of those kinds of things we've seen over the last number of months, that the very next day the numbers start to change. So what you hope is that by having people more limited in their social interaction, by people following the rules, wearing face coverings and so on, that you see those numbers go back down towards the numbers that we were talking about for earlier this fall, even 40 cases a day. And the other kind of thing that is moving a little bit in the right direction, so again, it's not a direct result of measures taken in the last few days, but maybe a measure of what's been going on for the last period of time, is the reproduction factor of the virus, and that you want it below 1. So it means for every case you get, there's less than one other case that arises from it. And in this case, it's gone from about 1.4 down to around 1. So that's a good trend. So we take these things one at a time. I listened to what Dr. Davila has to say about this, obviously, and we hope that the measures that have been undertaken, plus people's own personal behavior, will lead to the kind of improvement we saw over the summer.
When we look at certain parts of the city, specifically the northwest end of the city that has been significantly hit when it comes to case count, are there going to be more investments being made? Obviously, we're looking at the budget as well, but more investments made in these communities.
Well, the answer to that is yes, because one thing that we knew before the pandemic, but we know it in sort of stark relief because of the pandemic, is that when you have people who are underhoused, for example, living multiple families, multiple generations in a very small apartment, when you have people who are underemployed, it makes it difficult for them to afford proper housing or even to afford to feed their family, and the two are very much connected together. And so really what we're going to have to do is carry on and step up our efforts with regard to poverty reduction, for example, because, we've seen from the pandemic in very clear terms that people's status, their socioeconomic status, their housing, their employment, all have a relationship to their health ultimately. And we need people to remain healthy first and foremost and safe. And then, obviously we can work from a better position on their relative prosperity. So the answer is yes, there will be additional investments. And we just have to sort of figure out how to do that within the context of a city that is stretched in terms of its finances at the moment.
Indeed. Should people be nervous, though, that there will be some cuts made? I know in your conference yesterday that the intention is to not cut where it's really needed, but then there's an argument that it's needed everywhere right now. So where are we looking at for priorities?
Well, I want people to be assured that we're looking at the budget to find the places where we can achieve efficiencies. And for this year, for example, we found $500 million in different kinds of efficiencies and savings by slowing certain things down and so on, but in a way that the public wouldn't notice in terms of service delivery. My objective will be the same as it was for this year. I worked really hard this year, and it was really my personal responsibility as mayor to work with the other governments. And I commend them for the fact they stepped forward, the federal and provincial governments, to help cities, including Toronto, to deal with some of the shortfalls we experienced and some of the increased costs we experienced looking after homeless people, looking after food security issues and the elderly and so on. And so we're going to have to go back at having that discussion. I think the problem will be a little less severe in 2021, but nonetheless, it will be a significant size problem. And my objective will be to address it through things we can do to find our own efficiencies, but also through help from these other governments on the basis that a strong Toronto is going to be in the best interests of the province and the country, because we represent a huge part of the country's economy. And we need to have people healthy and ready to take on responsibility, and supported. And so I'm not going to be sitting here as yet at this point predicting service cuts or huge tax increases, because tax increases are also very inappropriate big ones at this point in time.
Mm-hmm. When we look at the TTC, we're getting a lot of viewer reaction we have from that picture, but more so the response from the TTC, which I know you've noted was somewhat insensitive to say, yes, you can physically distance, wait for the next one, which is impossible for a lot of people. We heard from the TTC CEO, Rick Leary, who we spoke to a little bit earlier on, who said, they're tracking and they're monitoring numbers and seeing what they can to adjust service. But with that, of course, money's needed. The province has said that they've provided some money to the city, but is it enough to perhaps ease some of the congestion that we're seeing? Is it possible? I know it's not happening on every bus and on every route, but can we bring back some of these drivers that have been laid off previously due to the pandemic?
Well, let's look at the situation. Overall, 92% of buses are traveling with 25 passengers or less on them, which is half full. So there is some ability there to do physical distancing. But as traffic comes back onto the system, we've said all the way along that it's not going to be possible to have 6 feet between every passenger if you think about it in the context of streetcars or buses or subway cars. The issue of the remaining people who are off work, 13,000 employees in total. At the TTC, 175 are on layoff at the moment, of which I think about 50, if I'm going from memory, are 95 are bus drivers. And in order to bring back the bus drivers, you have to have buses for them to drive, first of all, and there aren't a lot of sort of buses that are sitting in the garage. There's some that have to be set aside for maintenance and for serving for those shuttles when the subway runs, breaks down and so forth. But I'll just say to you that the seniority rules require us to bring people back based on seniority in the union contract, as opposed to being brought back because they're bus drivers. So it's more complicated. There are no easy answers to this. I will just tell you, Mr. Leary and the TTC executives are on this every single day. They're looking at it. They have allocated, I think, more than 100 extra buses to some of the routes where there's been some evidence of crowding. And so it's one of those things where we're trying to do our best every single day, but there's a whole different series of balancing acts that are required in order to do all of this. And I will say one more thing, which is that notwithstanding the suggestion made by the woman who tweeted, and she did get treated insensitively in the response, but notwithstanding what she said about masks, 97% of TTC customers are using a face covering. I thank them for that. I hope they continue to do that, and I hope the other 3%, some of them have medical issues and whatnot, but I hope those who choose not to wear a mask will change their mind, because it's very important to keeping people healthy on the transit and keeping the transit itself safe from a health perspective.
Absolutely. Mayor Tory, I wish we had more time with you. We have run out, but again, we'll check back in. Same time, same day next week. Thank you.
We'll look forward to that. Thank you, Mel. Bye-bye.
Appreciate it.